55 boxes of bees are sprinkled across Sanibel Island. The island, just off the coast of Fort Myers, was hit hard by Hurricane Ian last year. Beekeeper and owner of Sanibel Honey, Brad McKenzie, stayed on the island when the storm hit so that he could be there for the bees once the storm passed.
And my reasoning was that I was going to have to pick up some hives that had been blown over by the wind.
His hives weren't just knocked over, though. They were all destroyed. McKenzie is just one of many farmers who saw all of his hard work washed away from Ian. Natural disasters cause massive destruction to fields and buildings, but they also take their toll on farmers' mental health. Research shows farmers have increased anxiety, stress, and depression after loss from natural disasters.
A lot of times that looks like crop loss, livestock loss. We hope that it is not human loss, but unfortunately, I think sometimes in natural disaster cases it is, but also just general damage to property. And in each instance, those things are emotionally draining and upsetting, but we also take a significant hit financially.
Farmers can experience a lot of pressure and stress, but they don't always take steps to address it.
Uncommon. We see the stigma of it all. I think that farmers and ranchers and agriculturalists at large, I don't want to make generalizations, but there's this idea that we are resilient and there's grit there and hardworking and we're independent. And I think sometimes we see that then there's often a lack of a willingness to seek help or admit that we even need help or are struggling.
Stigma surrounding mental health can hold farmers back, but so can lack of access to resources. Rural communities these farmers live in may not even provide them the opportunity to seek help.
In a lot of our rural communities and areas, it's hard to find general practitioners and rural clinicians and things like that serve and that are able to support their health. And then for mental health resources, it's even less, right? Because farmers and ranchers are often self-employed if they don't have off-farm work, and so they might not have insurance that covers mental health care.
There are programs designed to provide assistance, such as the Extension Disaster Education Network.
They're a wonderful resource who are boots on the ground doing a lot of work to kind of connect with farmers and ranchers and make sure that they get the help that they need from a very technical perspective. And
the National Institute of Food and Agriculture is currently working on expanding programs for mental health and understanding what needs exist. There are also programs like Farm Aid that provide resources for farmers, but for these programs to be successful, farmers have to seek support.
When everyone needs help and everyone is in crisis, it's hard to feel like you are able to say, I need help, because again, a lot of people are in that situation.
Looking back at the past year, McKenzie says there have been a lot of ups and downs.
It's been really stressful.
He has had to hire multiple contractors to rebuild his house, has been working on rebuilding all 55 hives, and is yet to really make money from selling honey.
You just have to ride out the storm, and it's been a long storm. It's been almost a year now.
McKenzie has almost gotten his hives to where they were, and he plans on continuing to take care of them. Farmers are often tending to their crops, their land, their livestock, but it's important that they take time to take care of themselves. Megan Hartnett, WUFT News.